Mr. Lumet? Hi, you remember me? I'm Sophie, your student nurse for the day. This is Miss Michaels, my nursing instructor. We have your medication for you. Mr. Lumet has been having some difficulty speaking. I'll try to keep my questions to a minimum. Can I double check your ID band, please? Thank you. Your name and birth date?
Max Lumet, April 24th, 1949.
Great. Now I'm just going to check your ID number and scan your ID band. Okay, I don't see any allergies in your chart. So, do you have any allergies?
No, not that I know of.
Good, thank you. Since it's hard for you to swallow, we're going to give you the medications to you through your tube. That way you won't have to swallow them.
And you'll want to remember to check the medication labels for the third time with the medication administration record.
Okay, guaifenesin, 400 milligrams, 10 ml, and furosemide, 20 milligrams. Okay, they both match. So we're good to go, Mr. Lumet. Just 2 for now. I have your guaifenesin to decrease your cough and your furosemide for your blood pressure.
Now he should be sitting up as upright as possible.
Okay, I'm going to raise the bed up a bit. A little more. How's that? All right?
Now remember your gloves. Now walk me through what you're doing.
Well, I already changed the irrigation set and filled it with fresh water. Mr. Lumet, is it okay if I move your covers and gown? Let me put this pad under here. So first I'm going to check tube placement. Because the tube is already clamped, I'll remove the end cap and attach the syringe to the port for medication administration. And unclamp the tube.
Attempt to aspirate and note the amount of any residual.
There is no residual. Now I apply the clamp to the feeding tube again and remove the syringe.
Good. Then what?
Remove the plunger of the syringe. Reinsert the syringe in the gastric tube without the plunger. And pour 30 milliliters of water into the syringe. Now I unclamp the tube and let water enter the stomach via gravity infusion.
Next, you administer the first dose of medication by pouring into the syringe.
Okay.
Good. Now, clamp the tube. Since you are giving more than one medication, follow this medication with a 5 to 10 milliliter water flush before you give the next drug. So pour 10 milliliter in the cup that the furosemide was in and pour that into the syringe. This will rinse the cup and provide your flush.
Okay, I unclamp the tube and flush the tube with the 10 milliliters of water.
Now, pour guaifenesin into the syringe, pour a little water into the cup to rinse, and administer to the patient. Clamp the tube. Since you're finished with the medications, you should pour 30 to 60 milliliters of water into the tube to make sure the medications are completely removed from the tube. Unclamp and allow the water to flush the tube.
Then I clamp the tube. And I remove the syringe and replace the end cap on the tube.
And if the patient was receiving a feeding through the tube?
Then I would reattach the feeding tubing, unclamp the gastric tube, and restart the tube feeding.
If the patient's receiving a tube feeding, the head of the bed must remain elevated at least 30 degrees. You can remove your gloves now.
Right. Mr. Lumet, How are you feeling? Good?
So now you document the administration of the medication. Remember, you'll want to evaluate the patient's response to the medications within the appropriate time frame for the drug.
That's all for now, Mr. Lumet. Can I do anything else for you? Get you anything?
No, thank you.
Okay, you know where the call button is. Don't hesitate, okay? We'll check on you in a little while.
We'll see you, Mr. Lumet. Thank you.